Welcome. If you're a medical trainee working on the front lines of healthcare, this explainer is for you. We are going to break down one of the most critical challenges you will face in your career: antibiotic resistance, and more importantly, your role in fighting back. So let's dive in. Because the problem, well, it's a lot bigger than you might think. Let's just start with a number that should really grab your attention: 30%. A full 30% of all antibiotic prescriptions written in the outpatient setting in the US are considered totally unnecessary. Think about that. That is an incredible amount of medicine that isn't helping anyone and, in fact, could be causing real harm. And if you thought that was bad, just wait. Inside the hospital, it gets even worse. 50%. Half of all antibiotic use in hospitalized patients is either unnecessary or just plain inappropriate. 50%. Imagine that on your next ward round. Look, this isn't just about a little bit of waste here and there. This is a full-blown crisis of overuse. Every single one of those unnecessary prescriptions is like adding fuel to the fire, directly driving the emergence of antibiotic resistance. It's making the drugs we count on less and less effective for the patients who actually need them. So what's behind these insane numbers? Well, a huge piece of the puzzle is that we're treating things that, well, they just don't need antibiotics. The two biggest offenders: acute respiratory infections, the common cold, bronchitis, which are almost always caused by viruses. And the other big one is asymptomatic bacteriuria. That's just bacteria hanging out in the urine without causing any actual infection. But here's the thing. This is not a hopeless situation. And what's really interesting is how we fight back. That brings us to our core strategy, a concept that gives you the power to make a real difference: antimicrobial stewardship. Let's be really clear about what stewardship actually is. It's not about being the antibiotic police or just saying no all the time. Not at all. It's about precision. It's a smart, coordinated effort to use our antibiotic toolkit in the wisest way possible to get the absolute best outcomes for our patients today while making sure these drugs still work for patients tomorrow. And the goals are crystal clear and totally patient-focused. We want to minimize adverse events, and remember, there's about a 5% risk with every course of antibiotics. We want to cut down on those awful C. diff infections. And of course, we need to slow down the relentless march of resistance. It's all about optimizing everything: the right drug, the right dose, for the right amount of time. Okay, so that's the big picture. But the crucial question is, how do you actually do this on your next shift? How does this idea become a part of your daily practice? Let's break down the tactical playbook you can start using right away. This right here, this is basically the mission statement. It really lays out the entire game plan. See, it's not just one big action. It's a whole series of smart, deliberate choices that really add up. Everything from not starting an antibiotic in the first place to making sure we stop it as soon as we possibly can. So let's boil all that down into 5 core actions. I want you to think of this as your mental checklist. For every single patient, you should be asking, can I avoid this antibiotic? Can I simplify the regimen? When can I de-escalate based on the culture results? Is it time to convert from IV to an oral drug? And, maybe most importantly, how can I minimize the duration? Let's take that IV to oral conversion. This is a huge win for stewardship. It means we can get IV lines out, which reduces complications, and it helps get our patients home sooner. And a patient is ready when they're no longer febrile, their white count is getting better, they're looking stable, and, they have a gut that works. It's a simple checklist with a huge impact. Now, let's meet the enemy. All of this hard work, all this careful stewardship, it's all designed to help us win the fight against the most highly resistant organisms, the ones that pose a massive threat to our patients. These are the bugs that keep infectious disease doctors up at night. You're looking at things like MRSA, methicillin-resistant Staph aureus, and CRE, which is carbapenem-resistant Enterobacterales. These are the superbugs. They're often armed with defense mechanisms that just laugh at our standard antibiotics, making infections incredibly tough to treat. And this really highlights the tough choices we have to make when we're picking our weapons. On one hand, you have the old guard. Drugs like colistin. Yeah, it can be a last resort against some nasty bugs, but it carries a huge risk of damaging the kidneys. On the other hand, you have newer, more targeted agents that are much safer, but we have to protect them and use them only when absolutely necessary. So it all comes down to knowing which weapon to choose for which specific enemy. You can't use a sledgehammer for everything, right? It's about precision, knowing that ceftolozumab tazobactam is a great option for multi-drug-resistant Pseudomonas, or that simple old fosfomycin can still knock out an ESBL urinary tract infection. That's what modern stewardship is all about. And stewardship isn't just an inpatient game anymore. Modern strategies like OPAT, that's outpatient parenteral antibiotic therapy, are extending this careful management outside the hospital walls. This lets stable patients with really serious infections, like endocarditis, finish their IV treatment safely at home. Okay, let's bring this all home and focus on the single most important part of this whole equation, you. What does all this actually mean for you today on your very next shift? Remember those numbers from the beginning, the 30%, the 50%? Your choices, the ones you make every day, are what directly move those numbers. Every order you write, every time you pause and question the duration, every time you check if a patient can switch to oral meds, you are the steward. The power is literally in your hands. So as we wrap up, I want to leave you with this final thought. We are not getting a flood of new antibiotics anytime soon. The toolkit we have right now is pretty much what we're going to have for the foreseeable future. The power to protect it, to make sure it still works for the next patient who desperately needs it, that power rests in the prescriptions you write. So what choice are you going to make?